All right, good morning, everybody. I call this meeting to order at 9:04 a.m. We will proceed with roll call with Mr. Secretary Ricardo Lopez.
Good morning, everybody. Staff senators, I will now take roll call. Please indicate your attendance by stating aye or typing it in the chat. Antonio Alvarez. Ooh, where's my chat? There we go. Armando Ponce. Blanca Davila. Karina Alcantara. Edina Lopez. Edna Munoz. Elizabeth Reyes.
Aye.
Estela de la Garza. Francine Perez. Graciela Abrego. Jake Gonzalez. Jeanette Garcia. Juan Pablo Calderon. Leslie Orozco Zarate. Manuel Vidal.
Aye.
Maria Perez, thank you. Matthew Lerma. Matthew Munkus.
Aye.
Thank you. Mauro Uriegas, I'm sorry. Myra Garcia. Nicholas Swanson. Ofelia Jimenez. Omar Netzelski. Ruby Sands. Santiago Martinez. Stephanie Trujillo. Todd Holland. Victoria Lozano. Yesenia Carter. All right, Mr. President, quorum has been established.
Awesome. Thank you, Ricardo. Good morning, everyone. Happy Thursday. Welcome to our Staff Senate General Meeting for February 2026. We will begin our meeting with new business. Is there a motion to approve November 2025 and January 2026 meeting minutes?
I move to approve the meeting minutes for November 2025 and January 2026.
Is there a second?
I second.
All those in favor, please state aye in the Teams chat. All opposed? Any abstentions? The November 2025 and January 2026 meeting minutes have been approved. We will go on with our next part of the agenda, which is our guest speakers for today's meeting. We have Dr. Teresa. Dr. Teresa, are you on the call?
Yes, I'm here.
Awesome, perfect. You're able to share your screen whenever you're ready if you have a presentation, and you can go ahead and begin.
Okay. I don't really have a presentation. I was just gonna ad lib here.
Okay, thank you. Yes.
I'm Teresa Paliuka. I'm a radiation oncologist at the new Cancer Center, which is in the Commerce Square complex in the southeast part of McAllen. Cancer services are fully up and running. We do pretty full spectrum, full service, multimodality cancer care here. Most patients would never need to leave the valley. No more schlepping to Houston. The surgery center should be coming online shortly. Diagnostic imaging should be following them shortly. So we will have quite a lot going on here. The surgery center will be doing mostly outpatient procedures, maybe overnight stays. Even though we don't have a hospital yet, we can do almost everything that a cancer patient needs locally. We have relationships with other facilities that can fill in the gaps. There would be times when we might need to send patients out for very specialized care, like stem cell transplants and CAR T therapy, but then they would come back and continue their care locally. As far as the level of care, this is what you would expect to find at any major cancer center. We're not cheaping out here. If anybody has questions, feel free and ask anytime. One
Yes,
thing I wanted.
we can save questions for the very end, Dr. Teresa. So that way, of course, we'll give you time to speak, and then at the very end, we can save time for questions.
Okay, cool. One thing I wanted to put out to the general faculty population is that since we're the publicly funded entity, we have a mandate to improve healthcare for the entire population. Even though you can't go a block without seeing 6 medical facilities, gobs of doctors everywhere, this is still considered a medically underserved area. There are populations that are not getting the care that they need. Part of that is because the population around here is growing rapidly and the medical facilities are not able to recruit fast enough to keep up with the growth. Part of that is genuinely economically driven. It's access and finances. So we have a mandate to get those people into healthcare. I know some of you are probably working out in the field in various disciplines. We would love to leverage your connections in different communities. You've worked to establish your presence and build trust with the people you're working with. And if we could slide in on your coattails as a trusted resource to provide education and access. When it comes to finances, we are starting to work on developing a fund so that patients who are uninsured and underinsured will still be able to get care, not just for oncology services, but for everything. Healthier people are more employable. People who are more employable are more economically stable. And it just benefits everybody if people are getting the care that they need to manage whatever's going on health-wise.
Awesome. Thank you, Dr. Teresa. Was that I just want to be sure, was that all of your presentation?
That's all that I wanted to get out there, but if there are specific questions, as far as I go, have thumb drive, will travel, happy to give a presentation to anybody, anywhere, anytime. Just tell me when and where. Most of the staff here is bilingual. I can fumble around in Spanish reasonably well. Yeah, that was it.
Okay, awesome. If anybody has any questions, feel free to place them in the chat, or if you would like to unmute yourself, you may ask your question. We have our first one, Dr. Teresa. How many patients are you expecting to start off? Do you already have patients?
Yes, we are already treating people in radiation oncology. Upstairs in medical oncology, they're already also treating. We're expecting to have a reasonably busy practice. It's going to take a little while to build, but we are expecting to be reasonably busy, at least in the oncology landscape. If you call some of the other cancer clinics in the area, they'll tell you their next available appointment for a new patient is in 8 to 10 weeks. I can see a new patient this afternoon. Medical oncology, likewise, if you call them, they will get a new patient in within a week.
Awesome. Thank you. We have one question, one hand raised from a staff member here in the chat. Mariva?
Thanks, Jake. Good morning, Dr. Teresa. So my question is, you mentioned that, it's the same level of care and people don't need to go to Houston. So I do take my mom to MD Anderson. Over there, we have an app available. They tell us you're going to go to the West Wing, you're going to get lab work, then you're going to go to the East Wing, to meet with the oncologist. So we get everything done in one day. And as her results are coming in, I'm getting texts on their app like, okay, this is a result for, this, and that. And I keep on getting the dings on my phone in live time, if you will. Is that the level of care we can expect here?
We can expect something similar for sure.
Will she get if I decide to, try it out here, can I expect that all the services are going to be done here, like on the same day? Because I know quarterly she gets her lab work done at DHR, right? But DHR expects you to come in, a day or two before your appointment with the oncologist to get your blood work done.
Right.
So is everything going to be done the same day, or do we need multiple appointments?
We might need to do a separate lab appointment, but depending on what labs you're getting, we may be able to do it same day, unless it's something that's very specific that needs to be sent out.
And will she need a referral, or can she just show up? Like call in and make an appointment.
I think if you were to just call and make an appointment, we can take it from there.
Okay. Thank you. I appreciate your time.
Sure.
Awesome. Thank you. Dr. Teresa, we have a couple more questions. We have from Shakira.
Hi, good morning, and hi, Dr. Pagliuca. This is Shakira Ward, Senior Legal Officer and Managing Attorney for Healthcare out of the Office of Legal Affairs. I'm so glad that this information is being presented. Pursuant to the last question, though, I did have a clarifying response that a lot of the instantaneous nature of the medical record and results of labs has a lot to do with our medical record infrastructure. And so we are being connected with the use of Epic. We're transitioning into the Epic Healthcare Record by and through a function called CareLink. And that is being provided to us through our affiliation with UTMB in Galveston. And so to the extent that we can provide that, instantaneous lab information results and communications through the chart, it's really a function of the health record and not necessarily a function of the healthcare facility. So I just wanted to clarify that we are trying our best to get those different processes online so that it is smooth and streamless, it's seamless and smooth. But I just wanted to clarify that it's not really based on the facility itself. It's more so to do with access to the health record. Thank you.
Thank you, Shakira. Does anybody else have any questions for Dr. Teresa? Orlando.
Yes, good morning. And hello, Dr. Pagliuca. Had a question, if you could, or not necessarily a question. I was going to ask if you could speak a little bit briefly over or regarding the technology that's used there in the RADONC department, specifically the linear accelerator.
Oh, cool. You've done some homework. You have some knowledge in this field. We have a Varian TrueBeam, which is pretty much top of the line. We can treat just about anything that walks in the door. We can, if what you're asking is, can we do stereotactic radiation therapy? The answer is yes. We can treat things as small as 3 millimeters.
Liz?
Hi, good morning, Dr. Parduchuka. My question was, to access care there, do they need a referral from a PCP or the primary care physician, or can somebody that's interested or wants to seek services there or be attended there just call and make an appointment? How does that work at the referral system?
For insurance purposes, for some people, there may need to be a formal referral by their primary care provider. But if someone calls and wants to be seen here, and that's the situation with their insurance, we can contact their primary care person and get a referral. But that's usually a paperwork thing. If somebody wants to be seen here, we will get them seen here.
Great, thank you.
Awesome. Any last questions? No? Okay. I think we're good. Well, thank you so much. We appreciate you hopping on to our Staff Senate meeting to share about the services and everything. If we have any questions moving forward, we'll definitely reach out to you, perhaps maybe to come back and present to us again further on in the year. We have general meetings once a month, so we really appreciate your time. Thank you so much.
Anytime, thanks.
Our next guest speaker is Irma from IT. Irma, are you here?
Good morning.
Good morning.
Good morning, Jake. Good morning, everyone. Actually, I'm going to introduce our new ERI analyst. She is Clarissa Villarreal, and she should be here, and she will be presenting today.
Good morning, everybody. I'm here. Let me get my presentation set up so we can get started.
Awesome. Thank you, Clarissa.
Okay, are we able to see my PowerPoint? Perfect. Yes. Okay, so we're going to talk today about the ADA Title II Web Accessibility Rule. It took effect in 2024, but we have a huge deadline coming up this April 2026. So this presentation will cover the updated ADA Title II Web Accessibility Rule and what it means for all faculty, staff, and anyone who creates or shares public university content. Our goal is to explain responsibilities, timelines, and practical steps everyone can take to ensure that our digital content is accessible to all users. Okay, so what is ADA Title II? ADA Title II is a federal civil rights law designed to ensure that individuals with disabilities have equal access to programs, services, information provided by public institutions. For universities, this means ensuring that our digital resources are accessible and usable by everybody, including individuals who rely on assistive technologies such as screen readers or captioning tools. Why does this matter for universities? Universities rely heavily on digital platforms to deliver instruction, share resources, and provide services. When digital content is inaccessible, it creates barriers for students, employees, and for the public. Compliance is not only a legal requirement, but it also supports equity, inclusion, and student success. Who must comply? Compliance applies to the entire university. This includes academic departments, administrative offices, faculty, staff, and anyone who's publishing public-facing content. Accessibility is a shared responsibility across the whole institution. So this is where we're going to talk about the compliance deadlines. Large public universities must be in compliance by April 24th, 2026, while smaller public entities have until April 26, 2027. Accessibility is not a one-time task. Content must remain accessible as it is updated or newly created. What content is covered? The rule applies to websites, public course materials, downloadable documents, multimedia content, and university-related social media. Any digital content that is publicly available must meet accessibility standards. Required accessibility standards. The required standard is the WCAG 2.1 level AA. This is an internationally recognized framework that focuses on making content perceivable, operable, understandable, and robust for users with disabilities. What WCAG 2.1 AA means in practice. Practically speaking, accessible content must work with assistive technologies. These include text alternatives for visuals, provide sufficient color contrast, include captions for media, and use clear organization with proper headings and navigation. What this means for our faculty. Faculty should ensure publicly available course materials meet accessibility standards. This includes using accessible templates, captioning videos, and avoiding scanned or image-only documents that screen readers cannot interpret. What does this mean for our staff and offices? Staff should review and remediate public documents and web pages, ensure forms are accessible, and collaborate with IT and accessibility teams to address all compliance concerns. When using Cascade, or CMS web content, when working with Cascade, users should follow approved templates, use proper heading structures, include all alternate text for images, and avoid linking inaccessible PDF documents whenever possible. When using Adobe tools, Adobe Acrobat includes tools to help ensure PDFs are accessible. Users should run accessibility checks, properly tag content, verify reading order, and add documents metadash such as titles and language settings. Other content creation. Microsoft Word and PowerPoint also include accessibility checkers that should be used before sharing content. Canvas and other learning platforms provide accessibility guidance, and public-facing video content must include captions. What is not automatically accessible? Some content types require additional remediation. Scanned PDFs, images of text, videos without captions, and content that relies only on color to convey meaning are common accessibility issues. Exceptions. So some archived content or individualized documents may qualify for exceptions. However, these exceptions are narrow and must be justified carefully, so most public content must still meet accessibility standards. The benefits of accessibility. Accessibility improves usability for all users. It reduces institutional risk, supports inclusive learning environments, and aligns with the university's mission of equal opportunity. The next steps for your unit. Units should begin reviewing public websites and documents, request accessibility reports from IT, prioritize frequently accessed content, use accessibility checkers before publishing, and participate in training opportunities. The use of Microsoft Pilot to generate alternative text for images and verify text. So this slide is just going to show a brief example of how we used Copilot to create an alternate text for that image that's in orange. So tools like Microsoft Copilot can help generate alternative text descriptions for images. While these tools can assist, content creators should always review and verify accuracy to ensure meaningful and clear descriptions of images. When using emails, accessible emails should include clear subject lines, simple language, organized formatting, readable fonts, alternative text for images, sufficient color contrast, descriptive hyperlinks, and responsive design for mobile users. For PowerPoint presentation, accessible presentations should use built-in layouts, include descriptive slide titles, maintain high color contrast, include alternative text for visuals, use simple tables, verify reading order, caption multimedia, and run the accessibility checker before sharing. For documents, accessible documents should use structured headings, include alternative text for images, properly formatted tables, descriptive links, and clear, readable language and formatting. For those of us who have newsletters for our departments, no newsletter platform is fully ADA certified, but accessible newsletters should support alternative text, semantic HTML structure, strong color contrast, mobile responsiveness, and text-only email alternatives. Microsoft Sway offers built-in accessibility features. So for web and social media, accessible social media includes alternative text for images, captions, and transcriptions for videos, clear and descriptive links, sufficient color contrast, readable hashtags using camel case, minimal emoji use, and avoid autoplay media. For the web accessibility reports, accessibility reports from IT are helping identify high-impact issues and quick improvements. These reports support strategic remediation and help track progress towards compliance. Our web accessibility training. Training resources such as WebAIM and KnowBe4 help web contributors learn accessibility best practice and compliance strategies. PDF accessibility training. PDF accessibility training teaches users how to create compliant and screen reader-friendly documents that meet ADA standards. Accessibility and online courses training. This training helps instructors design online courses that support students with disabilities and follow accessibility best practices. University accessibility and technology support teams. Several campus teams support accessibility efforts include web accessibility specialists, student accessibility services, and the technology assessment process for evaluating software and compliance. Additional resources include state accessibility policies, DOJ ADA guidance, WCAG standards, accessibility fact sheets, and WebAIM learning materials. These resources provide ongoing guidance and reference support. And that's the end of my presentation.
Awesome. Thank you, Clarissa. Thank you,
Thank you,
Irma.
Clarissa. So, just to add to Clarissa's, I know that we're telling you, hey, we gotta comply. We're telling you why we need to do it, by when we need to do it, and you're like, how do I do it? So the next step for me is we are going through two different departments, and informing the people who are content creators. So everyone who is a content creator or digital content creator, you create a PDF that you intend to share externally on a website or within your department. It needs to be compliant. And so we did mention that there's a couple of trainings that you can already start exploring. We do have links to a lot of different trainings, but IT has created this knowledge article that is going to help you with this remediation process. The first thing we need to tell you is this: from today, if this is the first time you've heard about this, that we need to be in compliance, starting today, do not publish anything that is not 100% ADA compliant. And this is coming from our legal team as well. They are advising us, please don't create anything from here on if you're not 100% sure. And go back and review everything you've already created. Check to see if it's still in use. If it's no longer in use, archive it. As Clarissa mentioned, anything that's archived is not going to be in scope of, or in play of these things. So that's going to be our strategy. Our strategy is starting today. Anything that we are going to be publishing is going to be 100% compliant. Everything that we've published in the past, we need to review to see if it's still in use, archive it, and if you have to go back and take it from archive, just make sure that when you do take it out and you plan to use it again, that is 100% compliant. It doesn't make sense that we go and start cleaning and we're leaving, we're making a mess behind us. So that's the whole point of doing this. And just real quick, this article is in our KB, our team dynamics. I'm going to drop the link here so you can get started there. It's going to tell you about how to get your reports, and a little bit more information just to refresh everyone. But it has very specific steps. It's talking about, what do I do first? First thing is submit a request for your web your website. There's thousands of PDFs out there that are in play that you may don't even know they exist, and you're like, how am I going to know? So, request that report. A lot of it has to be manual. I just need to remind you that, yes, we have tools, but that's only like 50%. That only gets us 50% of the way. The other 50% is going to be manual review by your team members. And our website content managers, they are only the custodians. They're the ones that help us move the content that you created up until to be viewed and external for external sources. But you as a content creator are responsible for making sure that before you give that content over to be published, that you are 100% sure that it is in compliance. It is our responsibility as creators. It doesn't fall on the web content managers. Just want to be very clear about this. So we do have Jessica Sanchez from the Colt member. She provided this log on how to, once you get that report or you start identifying manually that these things need to be remediated, start adding them to your log. And there's a log that you can add these things to, so you can keep track of them. And then you can make notes and see who's going to fix what. Like, it'll help you do that. If you have another process, that's fine. As long as there's a way for you to track what are you fixing and by when and who is doing what. Because we might be asked, if we're audited, we're going to, like, how are you fixing your items? So you're like, oh, I have this. At least you have a little log saying, hey, this is what I identified. This is what I'm working on. And this is who's fixing it. And if you run out of time, well, you run out of time, but you're on the work or archive it. There's checklists that are out there. You're like, okay, so now I have this document. How do I know what I need to do? So there's checklists, compare it to this checklist, go through it, make sure that everything is in compliance. And if it's not, then that's where you log in and say, okay, I gotta go and fix these things because based on the checklist, I'm missing these things. So yeah, review all, and when we say all content, we mean all content. Blogs, newsletters, PowerPoint presentations, specifically your published PDFs. And I've added a link here that our team from UMC, and this is a university collaborative effort. I just want to let you know. So they provided this link for us so that you can see all the PDFs. You can go and check which different department, and what kind of PDFs and how many. Look, these are the list of PDFs online, and it'll tell you how many clicks it has and how many impressions. So for the department here of U Central, I would strongly recommend that those that are with the highest clicks, that you make sure this one is in compliance. Like, try to use by priority. And so this is a really neat tool that they provided for you to, it's for transparency. Everybody can go and look at this right here and other things. We have some videos here to support as to why. And of course, we have accessibility tools. You're like, okay, I fixed it. How do I know if I did the right thing, or can I check it? And so there are some browser tools that you can use. We've recommended these two, Site Improve and Level Access browsers that are recommended by our web team. And also start using and make sure you are using these built-in Microsoft Accessibility Checkers. If you don't know how to use it, there's trainings online. And of course, like I mentioned, the Microsoft Copilot, use that as well for the alt text, for video scripts. When you upload a video to YouTube, there is an option for you to add a transcript, but it only does it phonetically. So yes, it might sound correctly, but it may not make sense to somebody who's using a reader. So you still have to go again manually, like half machine, half manual review. And that's pretty much it. There's other training resources if you won't mainly work with web content, there's some trainings here. If you mainly work with PDFs, there's some trainings here. Videos, social media, and of course, creating courses on Brightspace or trainings. I'd like to invite you you're not alone. We're here to support you. We have been transitioning this program. We're going to be building one, and we're transitioning from HR to IT. So we will be providing the most support for you as much as at the best that we can. We have a team across the university that is here to support you. So join our Microsoft Teams Digital Accessibility Support community today. I'm gonna also drop the link here so that you can start joining, and we will start having support sessions. Maybe we'll introduce the tools like little by little, but we need you to start using these tools and making sure that we are in compliance, our whole university is. Ask questions. There's a channel where you can ask questions. Somebody will come in and answer that. Clarissa will be on top of that. If she doesn't know the answer, she will get you the answer from, the best where we need to get it. And of course, we will be announcing some training sessions there and on our training services portal. But mainly, this is where we're going to be supporting all of you to keep everything in place, and we can learn from each other and support each other so we can meet this deadline and continue to be in compliance from here and on. Remember, it's not just a one-time thing. It's going to be a program where it doesn't stop. This is security and accessibility is in everybody's job description. So that's all we wanted to say today. Thank you for your time, everyone, and thank you for inviting us.
Thank you,
Any
Irma. Thank you,
questions?
Clarissa. Yes, we do. We have a few questions in the chat. I'm going to go in order. Is there a way, I know it was shared last meeting, is there a way to reshare the presentation, Clarissa, that you just presented on? If staff want to have it with them, they can download it just for reference?
Yes, of course, we can share it. I was also telling Irma that if you guys do join that support community that we have on Teams across the university, it's also going to be in there so that way you guys can have like easy access to it.
Okay.
Veronica
Awesome.
just dropped the link to the presentation, and we're going to be making this presentation is live, and we're always adding new information. But we're transitioning from just the presentation over to our community. That's where it's going to be like you can get answers right away. And we'll add it there too.
Awesome. Awesome. The next question is, will accessibility training be mandatory?
Yes, for all content creators, it will be mandatory. It's going to be on the KnowBe4. We're working to put it on the KnowBe4 platform. So it's going to be like a yearly training. It's something that's going to be ongoing. So anybody who is going to be creating that content needs to be up to date with rules and regulations regarding accessibility. So we will also be informing that, and that training will be mandatory.
For everyone.
Mm-hmm.
Awesome. The next